We try and make them generally make them pain-free. We have different techniques. We have gentle adjustments for babies, kids, pregnant women, but we do have more manual techniques that will give a cavitation, or some patients call it a pop or a crack feeling. Some patients like a deeper, stronger adjustment, which we can provide, but traditionally we try and start slow. We try and give her an adjustment that's gentle enough that's going to give you the effective treatment that you need. If you need more, always let us know and we'll be happy to give a deeper adjustment, but we try and make our adjustments be as safe and comfortable as possible.